experience, I've had great success. And Dr. Stewart's nodding his head. I think that probably he's had the same experience. There are some other agents that are available, but really, the bottom line is we can, in the majority of cases, really alleviate these behavioral problems and make a significant difference. Orthostasis, I mentioned a moment ago about the problems with low blood pressure. Again, this problem is very treatable. One of the easiest things to do is the following. It's not uncommon for me to see a patient with Lewy body disease who earlier in life had high blood pressure, had hypertension. And so it's, makes sense that they were placed, at some point on medicine to treat high blood pressure. Well, the reality is that patients with Parkinson's disease and Lewy body disease, the chances that they will have trouble with high blood pressure is low because of the way the disease is affecting the nervous system and affecting the nerves that control high blood pressure. So it is uncommon, I'm not saying never, but it is rare that a patient with Lewy body disease needs to be on a medicine for high blood pressure. Okay? And if you get the person off of that, often that's all you need to do to relieve this problem with the low blood pressure. And again, you'll know that that's a problem. The patient, yourself, or the family members, a person stands up, they get lightheaded and dizzy, and like they're going to faint. That's telling you the blood pressure is too low. If they're on a medicine that lowers blood pressure, well, again, probably they don't need to be anymore. But let's say that even if, they're not on such a medicine or they come off and it's still a problem, there are medicines, including, the one that I really use typically if I have to is this one, midodrine. Very effective at alleviating this problem. If you can control that low blood pressure in the patients, you will prevent many of the falls and other problems that can occur. The Parkinsonism itself, levodopa, the active ingredient of the old medicine Sinemet, very helpful a lot of times. Certainly patients with Parkinsonism of any sort deserve a trial of this medicine. Parenthetically, I should say that a patient who's got Lewy body disease and Parkinsonism, the chances that a dopamine agonist, what are these medicines? Medicines like pramipexole or Mirapex or ropinirole or Requip, and then there are others, the chances that those medicines will alleviate the Parkinsonism is basically close to zero. The chances that it will exacerbate psychosis, probably 90%. The chances that it will exacerbate the orthostatic hypotension, probably 90%. Bottom line, I don't use those medicines in patients with Lewy body disease for their Parkinsonism. It's not going to alleviate the Parkinsonism in my experience and often has significant side effects. Now, getting back to this issue about patients with Lewy body disease having these, during their fluctuations at times being hard to arouse, seeming like they're, asleep or delirious or whatever. We used to think maybe it was because there could be some mild seizure activity going on, but more recent work, particularly by Brad Bove, has indicated that, just like the part of the brain that controls initiating the paralysis of muscles during REM sleep while we're dreaming, that same part of the brain, or areas of the brain we call the RAS, reticular activating system, that they're affected in DLB such that a patient can go from being wide awake to asleep, very rapidly, almost like somebody with narcolepsy, a condition y'all may be familiar with too. Now, acting on that insight, using medicines that we use to treat narcolepsy, like methylphenidate or Ritalin, can be very effective. And you don't need to use high doses. So modafinil is another choice. Bottom line is that problem can be alleviated in most patients quite significantly. Sialorrhea means excessive drooling that I talked about. It can be a real bear. The good news is it's very, very readily treatable. Believe it or not, the treatment of choice is botulinum toxin. Now, that's a long story. I won't go into great detail about it, but Botox has significant medical applications. It's kind of been turned into a joke because of the people in Hollywood and the plastic surgeons, but the reality is Botox was developed by neurologists to treat neurological illness 25 years ago. And treating the drooling with Botox is very, very effective. Chances for side effects are extremely low. The problem is that there's certain medicines that will have an effect on acetylcholine, and by blocking it, that sort of dries up your salivary glands and things like that. So doctors may want to use those, but they all make cognitive problems worse, so they're not a good choice. But like I said, Botox, injecting that into the parotid glands, the main glands here that produce saliva, very effective, and typically will last anywhere from 4 to 6 months. So most patients can get by maybe with 2, maybe 3 injections a year, but often just 2. Makes a big difference. Okay, one of the real greats in neurology was a physician, neurologist in France, Jean-Marie Charcot, in the latter part of the 19th century. He did many great things and really, I think, helped establish our discipline of clinical neurology. But I really like this quote from him because I think it really is so appropriate for Lewy body disease. Charcot wrote that disease is very old and really nothing about it has changed. It is we who change as we learn to recognize what was formerly imperceptible. Again, Lewy body disease has been here, I would bet, ever since mankind has existed, or at least lived to be, above the age of 50. We didn't recognize it, but it was staring us in the face. One of my other medical heroes is Sir William Osler. Osler, one of the real greats, said, the eye doesn't see what the mind doesn't know. He's so right. All of these things occur. We don't see them. Because our mind, we don't recognize what's going on, even though it's staring us in the face. It's only by gaining these insights that we're going to get better in treating these diseases. Now, I'm going to conclude my talk with a basic overview of neurodegenerative disease and to sort of help put this in context. And again, I mentioned this at the very beginning of my talk. Remember, neurodegenerative diseases encompass many disorders. Alzheimer's and Parkinson's disease are the most common. There are many others, though, including Lou Gehrig's disease, PSP, others that maybe you haven't heard of. The bottom line is all of these diseases share the feature that they are associated with certain nerve cells dying off at an accelerated rate. Now, trying to understand, or comprehend why certain nerve cells are dying off prematurely is, really what our main task is. If you think about it, given that all of these disorders share that same basic mechanism, well, it stands to reason that if we make a breakthrough, let's say with Alzheimer's disease, there is a very strong probability that the insights we gain from that research will translate into better therapies for the other diseases. Parkinson's disease, same thing. The bottom line is, I think sometimes patients and their families get discouraged because they say, well, my mom has Lewy body disease and it's not high profile. It's probably not getting all the research money that Alzheimer's and all this is. The reality is that neurodegenerative diseases in general, I made the point at the very beginning, we're talking about an epidemic here. It is imperative that we get better at treating these diseases. The altruistic reason is to help alleviate human suffering, but it actually transcends mere altruism. We've got to do better with treating these diseases because if we don't, we're going to have, really a catastrophe on our hands. It's already a catastrophe for patients and their family members, but just think about for society as a whole. Because of that, billions of dollars are being invested into research and development in treating and understanding these diseases better. That research, I have no doubt, will continue to yield results. Now, basically, you all know that the brain and the spinal cord, the central nervous system, we're born with many more nerve cells than we need. I don't know why God designed it that way, but that's how it is. So from the day we're born until the day we die,